stroke or transient ischemic attack. Definitions. The identification of insulin resistance as a risk factor for a stroke gave the possibility of applying pioglitazone, which improves insulin sensitivity. The presence of insulin resistance increases the risk of vascular disease, possibly due to associated hypertension, hyperglycemia, dyslipidemia, hypercoagulability, and endothelial dysfunction. Pioglitazone. Pioglitazone is an antidiabetic medicine that is used to treat type 2 diabetes mellitus non-insulin dependent. This type of diabetes usually occurs in adults. Pioglitazone is used to control blood sugar levels when you have type 2 diabetes. It allows your body to better use the insulin it produces. Ischemic stroke or transient ischemic attack TIA. Ischemic stroke is caused by a blood clot that blocks or covers a blood vessel in the brain. This prevents blood from flowing to this organ. Another cause is stenosis or narrowing of the arteries. Transient ischemic attacks occurs when blood does not reach the brain for a few moments. This may mean that you are at a risk of suffering a more serious stroke.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via two major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow. Immediate treatment for your stroke may help to minimize brain cell injury and death. If you have an ischemic stroke, you may be given medication to break up the clot causing your stroke. Later, your doctor may recommend surgery, such as carotid endarterectomy, to reduce your risk of having another ischemic stroke.
Applications of pioglitazone. It is used together with a diet and an exercise program. It is used with other medications to treat type 2 diabetes, and it increases the body's sensitivity to insulin. In ischemic strokes, because it causes insulin resistance, and pioglitazone make you have insulin sensitivity.
The side effects that are associated with pioglitazone are fluid retention, which can be treated with a diuretic or reducing the dose of pioglitazone, And as a patient, you should definitely let your physician know if you see that there's swelling in your ankles, edema, and if you fail to let your doctor know and you continue to retain fluid, the fluid can build up in your heart and cause heart failure. So it's very, very important that you let your doctor know if you're seeing swelling in your ankles. We also know that people who take pioglitazone are predisposed to gain weight because the pioglitazone stimulates the appetite centers in the brain. So it's very important that as a patient you're aware of the fact that pioglitazone will stimulate your appetite because you have to counteract this in order to prevent weight gain. However, unlike weight gain that occurs with overeating, the more weight you gain with pioglitazone, interestingly, the greater the drop is your blood sugar level with the drug. So the weight gain is a cosmetic issue, but metabolically there's a big improvement with pioglitazone. And also your blood lipid levels tend to improve, and there's also a decrease in blood pressure that we observe with pioglitazone. So these are very important additional benefits of pioglitazone because our diabetic patients very commonly have high blood pressure and high abnormal blood fat levels.
Pros and cons. Pros: the use of this medicine helps fight type diabetes 2 and also prevents ischemic attack, decreases triglyceride values, and hypoglycemia.
Good afternoon and welcome. I'm Bruce Viagale, Vice Chair of the ISC Program Committee. I'm here with Dr. Walter Kernan, Professor of Medicine at Yale University and PI of the IRIS trial. Welcome, Walter.
Thank you.
So we'll jump right into it. Walter, why did you and your colleagues do this trial?
Well, there were years, decades of research before we started showing an association between insulin resistance and risk for stroke and myocardial infarction. And then in the 1990s, along came anti-diabetes drug, which ameliorated insulin resistance. So we asked the question, is that drug insulin resistant to stroke patients and healthy?
Great. And so what was the design of the study?
It was a multi-center randomized placebo-controlled clinical trial.
And what did you find?
Well, we found that pioglitazone effectively prevented recurrent stroke and myocardial infarction among patients with risk of ischemic stroke or TIA who were not diabetic but had insulin resistance. It reduced the risk of recurrent stroke and myocardial infarction by about 24%.
What do you think the implications are for clinical practice?
Well, I think there are a few implications. One is that the results of our trials suggest that pioglitazone is likely to be an option for patients who are not in ischemic stroke to help them prevent further strokes and myocardial infarction. Keep in mind the patients in our study were already receiving optimal medical blood pressure control and so forth. However, we think it's going to take some time. The scientific community is very consensus about how they should be brought into clinical practice.
Were there any unexpected findings or concerns that might have impact on clinical practice from the study?
There were no unexpected findings, except perhaps that earlier had study. In previous research on pioglitazone, the drug had been associated with increased incidence of heart failure. We didn't find that, and that's resulted in us selecting patients who didn't have heart failure, but also managing patients who were sick. We did observe side effects that are reported with pioglitazone. Pioglitazone's been associated with bone fractures and we observed no side effects in our trial.
Well, Walter, congratulations on bringing such a terrific study to completion and on the very impressive results. Thank you.
Thank you very much.
Thank you all.
Cons: weight gain, edema, and heart failure, fractures, LDL increase, respiratory tract infections, headache.
This information is provided for public education purposes only and is not intended to substitute for a manufacturer's directions or consultation with a licensed pharmacist or healthcare professional. All medication, including those available over the counter, can be harmful if not used as directed, and taking more than one medication could result in harmful drug interactions. Please consult a licensed pharmacist or healthcare professional before taking any medication or changing an already approved or prescribed medication plan.
Hello, my name is Allie, and I'm a student pharmacist at the University of Arkansas for Medical Sciences. Today, I'm here to talk to you about your medication, Pioglitazone. Pioglitazone is also known as the brand name Actose. Pioglitazone comes as a tablet dosage form. Pioglitazone is most commonly used for the treatment of type 2 diabetes. Pioglitazone is usually taken by mouth once daily and is safe to take either with meals or on an empty stomach. Some common side effects with pioglitazone include swelling in the hands or feet, lightheadedness or shaking, runny nose, and sore throat. Some less common side effects with pioglitazone include headache, heart failure, and muscle and bone weakness. Do not take pioglitazone if you have heart failure or are allergic to pioglitazone. While taking pioglitazone, remember it is important to tell your doctor or pharmacist if you have signs of an allergic reaction, such as a rash, itching, swelling, or tightness of the chest, change in your vision or blurred vision, if you have blood in your urine, pain when you urinate, increase in the amount of urine produced, or pain in your lower back. Pioglitazone may weaken your bones, so discuss a way to keep them strong with your doctor or pharmacist. It's also important to tell your doctor or pharmacist if you start taking new medications, vitamins, or supplements. Thank you for watching, and if you have any further questions, please contact your pharmacist or healthcare provider.
This information is provided for public education purposes only and is not intended to substitute for a manufacturer's directions or consultation with a licensed pharmacist or healthcare professional. All medication, including those available over the counter, can be harmful if not used as directed, and taking more than one medication could result in harmful drug interactions. Please consult a licensed pharmacist or healthcare professional before taking any medication or changing an already approved or prescribed medication plan.
Issue applying in Ecuador. Recently in Ecuador, it has been observed an increase in cases of type 2 diabetes, which can be evidence of obesity diseases according to the latest statistics, which leads people to have health problems such as ischemic stroke or a heart problem. For this reason, Pioglitazone has played a great role in helping this population so that they can take a treatment with this medicine and thus ensure a better quality of life. Conclusion: Pioglitazone helps us to control type 2 diabetes and also to maintain insulin sensitivity when a ischemic stroke or a ischemic attack occurs. Whether the patient has diabetes or not, But if there is insulin resistance, this new application to medicine has led to a great step the chance of successful recovery after a stroke.